back to All in on Law. This is a medical video lecture, microbiology. In this video, we're going to talk about the sign and symptoms of Ebola virus. Why we're talking about this is there has been a recent outbreak in South African, African countries, okay, so like Guinea, Liberia, Nigeria, right? So we're going to talk about this sign and symptoms of Ebola virus. So in the previous two videos, we discussed about the pathophysiology of this virus and transmission, how it is transmitted from animal to human and from human to human, right? And in this video, we're going to talk about sign and symptoms. Let me tell you briefly about the virus, this virus. The this Ebola virus, it comes from a family known as filoviruses. In the filoviruses, we have two viruses, the Ebola and Marburg virus. This Ebola virus, it was in 1976. There were two major outbreaks of hemorrhagic fever in the city known as Zaire and Sudan. Okay, and the Marburg is a place in the Germany. Okay, the lab technician or the laboratory person who was working there, they got infected with this virus, okay, when they were handling the the infected monkey kidneys or cultural tissues, okay, that were imported from Uganda. Right, guys? So that's a brief information. So let's talk about the sign and symptoms. We have the early findings. Remember, the most important feature of this is the sign and symptom of this virus is they cause sign and symptoms similar to what you call a flu-like. Okay, right, guys? That's really very important. So flu-like symptoms, okay, if the person is infected with this virus, the Ebola virus, okay, within 2 days to 3 weeks, he can develop sign and symptoms of flu-like or due to Ebola virus, right? From 2 days to 3 weeks. And it's really very important to know because it is 50 to 90% of the fatal, it's 90%, 50 to 90% of the patients die because of this, right, guys? So we have early and the late features of this. Okay, so let me draw and write. So first, the early is a fever. Remember, the patient will have the fever, okay, will be having a high fever from mild, moderate to high fever, okay, even pharyngitis, okay, and rash could be there, right, especially seen in the white peoples, okay, and the bilateral conjunctival injection, okay. In later findings, they include a bleeding, and this is a really very important because it causes a hemorrhagic, means the patient is undergoing he's going to heading to a hemorrhagic fever, right, hemorrhagic shock, and that's really very fatal, guys. Okay, bleeding from the mucosal membranes, okay, myocarditis, pulmonary edema, okay, tachypnea, hypotension, anuria, and the coma, right? So these are the important features of this Ebola virus infection. Okay, so let's talk about this. This fever, even the patient can have in early flu-like symptoms, they can have headache, okay, they can have joint pain, muscle pain, abdominal pain, and even some patients experience vomiting, diarrhea, and loss of appetite, okay. And some other patients, but they are minor, they can have a chest pain also, okay, and trouble swallowing, that can also be seen, okay, guys. So the other important, what is the fatal finding of this is the bleeding. Remember, the hemorrhagic shock is really very dangerous in this. Okay, all people infected show some symptoms of what you call circulatory system involvement, including what you call impaired blood clotting. Okay, right guys, in the form of petechiae, purpura, ecchymosis, hematomas, right, vomiting of the blood, hiccup, coughing it up, okay, and a blood in the stool. So these are the very what you call the sign and symptoms of this viral infection. Okay, the survivors of Ebola virus disease have developed what you call the late manifestations, like they may have myalgias, okay, they can have asymmetric or migratory arthralgias, okay, fatigue, bulimia, amenorrhea, hearing loss, tinnitus, okay, and even the parotitis, remember. Okay guys, so these are the important signs and symptoms, and in the next video we're going to talk about the what you call the virology in detail regarding how the virus looks, what are its properties, okay, and how it is prevented. Thank you so much for watching this video. Take care.